Title: Long-Term Monitoring and Prevention in Connective Tissue Diseases, narrated by Dr. Yogesh. Introduction. Hello friends, welcome back. Today we're going to talk about something very important: long-term monitoring and prevention in connective tissue diseases, also called CTDs. You see, CTDs are not just short-term illnesses, they're chronic conditions. This means they stay with a person for years, sometimes for life. That's why regular follow-up, preventive care, and lifestyle adjustments are so essential. Let's break it down step by step. Monitoring side effects of immunosuppressants. Most CTDs, like lupus, rheumatoid arthritis, or scleroderma, are treated with immunosuppressants. These medicines reduce the overactive immune system, but they can also have side effects. Why is monitoring important? Because medicines like steroids, methotrexate, azathioprine, or mycophenolate can affect the liver, kidneys, blood counts, or even bones. Example: imagine a lupus patient taking steroids for many months. If not monitored, they may develop high blood pressure, diabetes, or thinning of bones. With methotrexate, there is a risk of liver damage, so doctors recommend regular blood tests, urine tests, and sometimes imaging to catch side effects early. This way, we balance the benefit of controlling the disease with the safety of the patient. NAV2. Vaccination in immunosuppressed patients. Because the immune system is weakened by medicines, patients are at higher risk of infections. Why does vaccination matter? Vaccines act as protection, almost like a safety shield. Example: an RA patient on biologic therapy may easily catch pneumonia or influenza. If they are given the flu vaccine or the pneumococcal vaccine beforehand, the risk drops significantly. Important point: live vaccines are generally avoided when someone is already on strong immunosuppressants. That's why vaccination planning should be done before starting powerful drugs. Number 3, preventive care. Long-term care isn't just about medicines. It's about protecting the whole body. Let's look at the 3 big risks. Osteoporosis. Steroids can weaken bones, so calcium, vitamin D, weight-bearing exercise, and sometimes bone protective medicines are advised. Infections. Immunosuppressants lower resistance, so doctors teach patients about hygiene, timely vaccines, and avoiding unnecessary antibiotic misuse. Cardiovascular risk. CTDs increase chances of heart disease and stroke. Controlling cholesterol, blood pressure, and sugar becomes very important. Example: a young lupus patient with high cholesterol and uncontrolled disease may develop heart problems in her 30s. Preventive steps like diet, exercise, and statins can lower that risk. So preventive care means looking beyond the joints or skin and protecting bones, heart, and immunity. 4. Counseling for lifestyle, fertility, pregnancy, and psychosocial aspects. This is often the most neglected part, but one of the most important. Why counseling matters? Because CTDs affect daily life, mental health, and even family planning. Lifestyle. Patients are advised to quit smoking, avoid excess alcohol, eat a balanced diet, and exercise regularly. Fertility and pregnancy. Women with lupus or APS need careful planning. Some drugs are unsafe in pregnancy, while others like hydroxychloroquine are safe and protective. Psychosocial aspects. Chronic illness can cause anxiety, depression, or social withdrawal. Talking with counselors, joining support groups, or involving family can make a big difference. Example: a woman with lupus planning pregnancy should shift to pregnancy-safe medicines 6 months before conception. Without counseling, she may unknowingly continue harmful drugs, risking both mother and baby. So counseling empowers patients to take informed decisions about their life. Quick reference: Dr. Yogesh key points. Friends, let's quickly recap the most useful points for daily life. Always monitor blood and urine tests while on immunosuppressants. Take vaccinations as advised. Avoid live vaccines when on strong drugs. Preventive care includes bone health, infection prevention, and heart health. Lifestyle counseling, pregnancy planning, and mental health support are equally important. Closing. So long-term monitoring and prevention is like building a safety net around the patient. Medicines control the disease, but monitoring, vaccines, preventive care, and counseling keep patients safe and improve quality of life. Thank you for listening. Stay tuned for more simplified medical explanations,